This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the 2026 issue of Annals of Medicine. It's a randomized, double-blind, controlled trial protocol titled Effect of Different Liposomal Bupivacaine Concentrations in Ultrasound-Guided Superior Trunk Block on Postoperative Analgesia and Mobility for Shoulder Arthroscopy.
Now, Alara, some of our listeners might wonder why we're discussing shoulder arthroscopy on a neurosurgery podcast. But for those of us focusing on peripheral nerve work or clinical pain management, the superior trunk of the brachial plexus is very much our territory. The management of severe postoperative pain in these cases is a major hurdle.
Exactly. The paper highlights that shoulder arthroscopy frequently causes severe postoperative pain that may impede recovery. Traditionally, the gold standard for this has been the interscaling block. However, we've always had a significant concern with that approach, the risk of hemidiaphragmatic paralysis due to phrenic nerve involvement.
Right, which is a particular concern for patients with marginal pulmonary reserve. That's where the ultrasound-guided superior trunk block, or STB, comes in. According to the study abstract, the STB offers comparable analgesia to the interscaling block, but with a specifically lower risk of that hemidiaphragmatic paralysis.
And this protocol takes it a step further by utilizing liposomal bupivacaine. We know that liposomal bupivacaine provides prolonged analgesia compared to standard local anesthetics, but the authors point out a major gap in the current literature.
Which is the optimal concentration, correct?
Exactly. The abstract states quite clearly that the optimal concentration of liposomal bupivacaine for STB remains unknown. This trial protocol is designed to address that exact question by looking at how different concentrations affect both postoperative analgesia and mobility.
This is a crucial distinction for our residents to understand. In neurosurgery and orthopedic-adjacent procedures, we aren't just looking for a numb limb. We're looking at the balance between pain control and early mobilization. If the concentration is too high, are we sacrificing mobility? If it's too low, are we failing on the analgesia front?
Precisely. The study is structured as a randomized, double-blind, controlled trial. By keeping it double-blinded, they're aiming for the highest level of evidence to determine which concentration profile allows for that sweet spot, maximizing the duration of the block while minimizing any adverse effects on motor function that could delay physical therapy.
It's also interesting to note the emphasis on ultrasound guidance here. In modern peripheral nerve interventions, the precision of ultrasound-guided superior trunk blocks allows for a more targeted delivery. When you combine that precision with a long-acting agent like liposomal bupivacaine, the pharmacological profile becomes the next logical variable to optimize.
It really speaks to the evolution of postoperative care. We've moved past simply managing pain to optimizing the entire recovery trajectory. If this trial finds an optimal concentration, it could standardize how we approach the brachial plexus for these types of procedures, potentially making the interscaling block a second-tier choice given the phrenic nerve risks we mentioned earlier.
For our medical students listening, pay attention to the terminology used here. The paper focuses on postoperative analgesia and mobility as the primary endpoints. In the surgical world, mobility is often a proxy for successful recovery and reduced hospital stay.
And for the residents, remember that the superior trunk is formed by the union of the C5 and C6 nerve roots. Blocking at this level, as the paper suggests, provides that comparable analgesia but moves the injection site further from the phrenic nerve, which typically courses over the anterior scaling muscle.
It's a sophisticated study of anatomy and pharmacology. I'm looking forward to seeing the results of this trial once the protocol is fully executed. Finding the optimal concentration of liposomal bupivacaine could significantly change our regional anesthesia protocols for the upper extremity.
Definitely. It's all about prolonged analgesia without the respiratory compromise.
Well, that's all the time we have for this deep dive. Thank you for joining us on the Neurosurgery Hub podcast.
See you next time.